Chickenpox is an infection caused by the varicella zoster virus, caused an itchy rash with small fluid-filled blisters. Chickenpox is highly contagious to people who haven't had the disease or been vaccinated against it. But today, a vaccine is available that protects children against chickenpox. Routine vaccination is recommended by the Centers of Disease Control and Prevention. The chickenpox vaccine is a safe, effective way to prevent chickenpox and its possible complications. The itchy blister rash caused by chickenpox infection appears 10 to 21 days after exposure to the virus and usually lasts about 5 to 10 days. Other signs and symptoms which may appear 1 or 2 days before the rash include fever, loss of appetite, headache, tiredness, and a general feeling of being unwell. Once the chickenpox rash appears, it goes through three phases: raised pink or red bumps, which break out over several days, then small fluid-filled blisters, which form in about 1 day and then break and leak, crusts and scalps, which cover the broken blisters and take several more days to heal. New bumps continue to appear for several days, so you may have all three stages of the rash: bumps, blisters, and scab lesions at the same time. You can spread the virus to other people for up to 48 days before the rash appears, and the virus remains contagious until all broken blisters have crossed over. The disease is generally mild in healthy children. In severe cases, the rash can cover the entire body, and lesions may form in the throat, eyes, and mucous membrane of the urethra, anus, and vagina. If you think you might have chickenpox, consult your doctor. He or she usually can diagnose chickenpox by examining the rash and considering other symptoms. Your doctor can also prescribe medication to lessen the severity of chickenpox and treat complications if necessary. To avoid infecting others in the waiting room, call ahead for an appointment and mention that you think you may have chickenpox. Also, let your doctor know if the rash spreads to one or both eyes, the rash gets very red, warms, or tender. This could indicate a secondary bacterial skin infection. The rash is accompanied by dizziness, disorientation, rapid heartbeat, shortness of breath, tremors, loss of muscle coordination, worsening cough, vomiting, stiff neck, or fever higher than 38.9 Celsius. Anyone in the household has a problem with his or her immune system or is younger than 6 months. Chickenpox infection is caused by a virus, which we talked about. It can spread through direct contact with the rash. It can also spread when a person with the chickenpox coughs or sneezes and you inhale the air droplets. Your risk of becoming infected with the varicella zoster virus that causes chickenpox is higher if you haven't already had chickenpox or if you haven't had the chickenpox vaccine. It's especially important for people who work in childcare or school settings to be vaccinated. Most people who have had chickenpox or have been vaccinated against chickenpox are immune to chickenpox. If you've had vaccinated and still got chickenpox, symptoms are often milder, with fewer blisters and mild or no fever. A few people can get chickenpox more than once, but this is rare. Chickenpox is normally a mild disease, but it can be serious and can lead to complications including bacterial infection of the skin, soft tissues, bones, joints, or bloodstream, dehydration, pneumonia, inflammation of the brain, toxic shock syndrome, which is caused by the release of toxins from an overgrowth or bacteria called Staphylococcus aureus or staph, which is found in many women's bodies, and Grace syndrome in children and teenagers who take aspirin during chickenpox and eventually death.
And if I'm not mistaken, chickenpox was the cause of the extinction of the Native Americans. Just like to throw that out there.
People who are at higher risk of chickenpox complications include newborns and infants whose mothers never had chickenpox or the vaccine, adolescents and adults, pregnant women who haven't had chickenpox, people who smoke, people whose immune systems are weakened by medications such as chemotherapy or by disease such as cancer or HIV, people who are taking steroid medications for another disease or condition such as asthma. Low birth weight and limb abnormalities are more common among babies born in women who are infected with chickenpox early in their pregnancy. When a mother is infected with chickenpox in the week before birth or within a couple of days after giving birth, her baby has a higher risk of developing a serious, life-threatening infection. If you've had chickenpox, you're at risk of a complication called shingles. The varicella zoster virus remains in our nerve cells after the skin infection has healed. Many years later, the virus can reactivate and resurface as shingles, which is a painful cluster of short-lived blisters. The virus is more likely to reappear in older adults and people who have a weakened immune system. The pain of shingles can persist long after the blisters disappear. This is called pathophytic neuralgia and can be severe. Two shingles vaccines are available for adults who have had chickenpox. Shingles is approved and recommended for people age. Shingrix is approved and recommended for people age 50 and older, including those who previously received Zostavox. Zostavox isn't recommended until age 60. Shingrix is preferred over Zostavox, which is the one of the two vaccines.
Okay, so prevention. The best way to prevent being infected with chickenpox is the vaccine. Almost 98% of people who receive both of the recommended doses don't get the like don't have any complications. It's pretty safe, and I think a lot of people here take the vaccine. I've taken it personally. Um, yeah, the vaccine is the best prevention. Next slide. The vaccine is especially recommended in for young children. Children receive two doses of the vaccine. The first between the age of 12 and 15 months, and the second between the age of 4 and 6, as part of the routine childhood vaccination schedule. We talked about this before, I think. The like when children are born, they take a certain number of vaccines. It's a routine that usually babies go through. Unvaccinated older children also should take the vaccine. It's recommended for them. Also, basically everybody who is unvaccinated needs to get vaccinated. Unvaccinated adults who never had chickenpox are at a higher risk because usually they have their immune system is usually weaker and they haven't had the disease before, so that makes them more at risk of developing serious complications. Yeah. People that shouldn't take the vaccine are pregnant women, people with weakened immune systems, because we know that the vaccine is a weakened version of the virus. So if the immune system is weak and uh, can't handle the vaccine itself, the weakened version, it will not even be like they can't handle it, and it can lead to serious complications. And people who are allergic to gelatin or the antibiotic neomycin, talk to the doctor before taking the vaccine. See if you have any problems with the vaccine and it will lead to any further complications. Next slide. Is it safe and effective? Yeah, for the most part, yes. Since the since the chickenpox vaccine has been available, studies consistently show that it's safe and that there's general and rare side effects that are mild, but it's usually safe and effective. Next slide. Diagnosis. Usually, doctors can tell chickenpox from the rashes that are physically appear. If there's any doubt about the diagnosis, they can be confirmed with a laboratory test, including blood test, or they can do a biopsy to make sure that it is chickenpox virus. And otherwise, healthy children, chickenpox typically needs no medical treatment. It goes away by its own. Your doctor may prescribe antihistamines to relieve itching, but for the most part, the disease is allowed to run its course, and it's not. Usually, it goes away by its own. If complications develop, your doctor will determine the appropriate treatment. He or she may prescribe antibiotics or skin infections and pneumonia. Brain inflammation is usually treated with antiviral drugs. Hospitalization may be necessary if it's a more severe case. Next time. What are some lifestyle home remedies that people with the virus can do? Some self-care measures that you can do. Avoid scratching. It can be itchy, so if you avoid scratching your skin, that's good. It's good to trim your nails so you don't open up the skin even more for more virus or more infections other than the virus itself. Slow healing and increase the risk that sores will become infected. If your child can't stop scratching, you can put gloves and cut their nails. That's fine. You could use things to relieve the itch, and instead of there's something that you could do to make it not so itchy. A cool bath with adding baking soda, aluminum acetate, uncooked oatmeal or colloidal oatmeal. These things that could relieve the itches. Calamine lotion dabbed on the spots. A soft bland diet. A diet can be helpful. Antihistamines such as uh, diphenhydramine. Check with your doctor to make sure your child is safe. Yeah, that's about it. If if fever lasts longer than 4 days and is higher than 102 degrees, you could call your doctor, and don't give aspirin to children and teenagers who have chickenpox because it can lead to serious conditions such as Ray's syndrome. Talk with your doctor before giving any type of non-steroidal anti-inflammatory drugs. Someone who has chickenpox, some studies suggest that this type of medication can lead to skin infections or tissue damage. So basically, if the fever lasts longer and is high temperature, you should consult the doctor and don't do anything out of your own because it could make things worse.